Hey, Dr. Gullberg here, continuing our internal medicine series. Today we're going to talk about hyperkalemia, high potassium, what the causes are, how we treat it, that type of thing. So basically, the causes of hyperkalemia, there are threefold. One is ineffective elimination of potassium. So obviously, when the kidneys fail, that's an issue. Certain drugs are a problem, such as ACE inhibitors, ARBs, and NSAIDs. So watch out for those. Addison's disease, believe it or not, causes hyperkalemia, as does potassium-sparing diuretics. So those are all common causes of ineffective elimination of potassium. Second big cause is excessive release of potassium. So we see people that have been down for 3 days, they get rhabdomyolysis. That's an issue. When they have gangrene or tissue necrosis, that's an issue. Chemotherapy causing tumor lysis syndrome. Watch for hyperkalemia in that state. And then, of course, people just with hemolytic anemia can have high potassium. The third cause of a high potassium level, of course, is just excessive intake from iatrogenic reasons, either oral potassium or IV potassium. So know about the causes of hyperkalemia. Now, in terms of treatment, once the potassium gets to be over 6.5, there's issues with myocardial excitability. And obviously, we're going to see peak T waves and that type of thing on the electrocardiogram. First thing we want to do is give people some IV calcium to stabilize the myocardium. Second thing we want to do is give them intravenous dextrose with some insulin to push potassium into some of the cells. We're going to add an amp of bicarb. That's important. Believe it or not, even an albuterol SVN treatment's very helpful to decrease that potassium level. And of course, we always add, if possible, K-exolate, especially orally, to help eliminate potassium through the GI tract. Lastly, IV Lasix is important, along with possible dialysis if the potassium is really out of sight, where cardiac arrhythmia is possible. So remember those 7 main treatments for hyperkalemia. Thank you. Dr. Gullberg signing off.